Now, first on the Western Slope, you're watching KREX5 News this morning.
Good morning and happy Friday. Thanks so much for starting your day with all of us here at KREX5 News this morning. I'm Jennifer Lee. Here's what you need to know to start your day. Walking 10,000 steps a day is a daily goal for many Americans, but one veteran is taking over 7 million steps as he completes a 3,600-mile trek across the country. 71-year-old William Shuttleworth is averaging 30 miles per day on his trip from Massachusetts to California, and he's doing it to raise awareness about important veteran issues like homelessness, suicide, and lack of health care. The New England native is meeting, sharing, and talking to any veteran he can on his journey, and he's battled weather elements along the way, including extreme heat, tornadoes, and snowstorms. But Shuttleworth says he's walking across the country on behalf of many veterans who don't have a voice.
This is a sacred spiritual walk for me. I feel I'm walking for them. I feel that my shoes are for the many people that didn't come back or came back too wounded to have a voice.
And you can follow William's progress, you can donate to his cause, or simply wish him well on his journey by visiting his website, vetsdon'tforgetvets.com. It might feel like summer just started, but in less than 2 weeks, students in School District 51 will be back in class. But the school day will look a little bit different this year for many students, especially for those who will now get to sleep in a little bit more.
Bad news, kids. It's August and time to start the grind once again. But this year it may be easier to show up to that first class bright-eyed and bushy-tailed.
I think having these new start times is going to be great for productivity and for students being ready and fresh in the morning to go to school.
School starts in less than 2 weeks and District 51 is changing things up a bit. They're offering later start times for teen students with the goal of increasing productivity by ensuring students get more sleep. But that's not the only goal.
We will have more students driving in light hours rather than dark hours because of the later start time, as opposed to kids who had before school activities or needed to be at school at 7:20. Those kids were in the car driving in many cases by 6:45. And as we know, in the winter months, that and even after daylight savings time ends, those are dark times.
And it's not just teens driving to school in the dark. Parents and grandparents get to participate in twilight commutes to school too.
I actually go to work at 5:30 in the morning, so their grandparents are going to take them, so that'll probably help them out because they like to sleep in a little bit, being grandparents.
Instead of waking up at 5, I'll probably wake up at 6, so an extra hour.
Wow. You wake up at 5 a.m. to go to school?
Oh yeah, well I just like to get fully awake before I go to school because I don't feel right if I'm not.
When do you wake up?
Around 10 minutes before I need to be there.
First on the Western Slope, I'm Rob Hagan with KREX 5 News.
And gearing up to go back to school means buying new supplies like pencils and notebooks, but it also means getting students the proper vaccinations. To make that process a little bit easier for families, Mesa County Public Health will provide walk-in immunization clinics on August 7th and 10th. Parents should bring their children's immunization records and insurance cards, and MCPH staff will check your child's records to make sure they're up to date. There are also options and programs available for those with low income or without insurance altogether. And those with Mesa County Public Health are stressing the importance of vaccines in preventing the spread of disease.
Vaccines are important for our entire community because they not only protect the person getting the vaccine, but they protect those around them who maybe can't. So if someone has a compromised immune system because of an illness and cannot get a vaccine, then those around them are protected so they're not spreading disease from person to person.
There are 6 vaccines that are required in Colorado for students in grades K through 12. Still, D51 says only 90% of school-aged children in Mesa County are immunized, which falls below the recommended threshold of 95% to prevent the breakout of illnesses. And don't forget, there's only a few days left to stuff the bus. The annual school supply drive runs through this coming Monday, so if you have anything you'd like to donate to kids in Mesa County, you can do so by heading to the Mesa Mall and just putting your donation onto the school bus that's parked inside. That bus will be unloaded on Tuesday, August 6th, so make sure you get your donations onto the bus before the Mesa Mall closes at the end of the day on Monday. And health insurance premiums are said to be dropping significantly for anyone purchasing a health care plan on the individual market. It's a welcome change here since Western Colorado has some of the highest health care costs in the country. KREX5's Mike KREX sat down with an insurance agent to find out exactly what the change means for us here on the Western Slope.
Insurance on the individual market in Colorado is set to change. According to the Colorado Health Institute, nearly 250,000 Coloradans pay for insurance on the individual market. That's to say they're self-employed or pay for their own health insurance, not through work. Roughly 8% of Mesa County get insurance through the individual market. Now here's where Colorado is seeing a problem. Some purchasers have high health needs and thus expensive medical bills, causing premiums to go up. And as premiums go up, so too does the likelihood of healthy people dropping their coverage, leaving a higher concentration of people with health concerns and making the market even more expensive, resulting in healthier individuals opting out. The medical industry calls it a death spiral, and that's where reinsurance comes in.
The reinsurance will help the insurance companies reduce their insurance premiums because they now have a larger insurance pool to cover high-cost claims.
That larger pool is coming from 3 places. First, the federal government. That's why the waiver program needed the Center for Medicare and Medicaid Services to sign off on the deal. The second, insurance companies. They'll pool together their own premiums and fees. And lastly, it's now possible for hospitals to be assessed fees too. And with more money pooled together, lower premiums, and hopefully more healthy individuals back on the market, Christine Bogot, a member of the Colorado State Association of Health Underwriters, says this is an important change.
This was a great bill that was passed. Many state legislators understood that a reinsurance program makes sense.
And while the prices for health care is always changing, it's hard to say exactly how much premium costs will be affected. The program will affect a large portion of the individual market, but not everyone.
It'll reduce the overall premium. Those people that are receiving financial assistance through Connect for Health Colorado may not see a reduction at all in their premium, but those that are not receiving financial assistance will see the net effect.
First on the Western Slope, Mike KREX, KREX5 News.